Skeletal system. Skeletal system comprises of bones, joints and accessory structure like cartilage, ligament, muscles and tendons. Skeletal system provides shape, stability, and protection to the internal organs. Skeletal system is divided into two, axial skeleton and appendicular skeleton. Axial skeleton. The axial skeleton consists of bones and cartilages that lie close to the central axis of the body. Axial skeleton includes skull, comprises of the cranial and facial bones, auditory ossicles, such as stapes, incus and malleus, hyoid bone, which located above larynx, vertebral column, consist of 7 cervical, 12 thoracic, 5 lumbar, 5 sacral and 4 coccyx, rib cage, formed by 12 pairs of ribs with associated costal cartilage and manubrium sternum. Appendicular skeleton. The appendicular skeleton is bilaterally symmetrical and comprises the bones of the upper and lower extremities and bony girdles which anchors extremities with the axial skeleton. The appendicular skeleton includes pair of scapula, clavicle, humerus, radius, ulna, carpals, metacarpals, phalanges, hip bone, femur, tibia, fibula, patella, tarsals, metatarsals and phalanges. Bones. Bone is a hard, dense connective tissue that forms skeletal system. Skeletal system is composed of 206 bones that connects via joints. Functions of the bones. Gives support and shape to the body, protects vital or internal organs, assist in movements by providing a rigid structure for muscle attachment and leverage, manufactures or produces blood cells, stores calcium and minerals. Classification of bones. The bones are usually classified in 3 ways: 1. According to the shape of the bone, 2. According to the structure, and 3. According to the development of the bone. Classification of the bones, according to their shape. Depending upon the shape and size, bones are classified into long bones, short bones, flat bones, irregular bones and sesamoid bones. Long bones. Long bones are usually cylindrical in shape. Their length is greater than width. Long bone consists of epiphysis, at its 2 ends, elongated tubular shaft, or diaphysis, and metaphysis. It contains medullary cavity filled with bone marrow. Example, femur. Short bones. Short bones are short and compact. Short bones tends to have equal dimensions of height, length and width, giving them in cubical shape. In addition to parts of long bones, it has more articulating surface area. Example, carpal bones. Flat bones. Flat bones has a flat, broad surface area but not thick, mostly curved and plate-like bones. Example, scapula. Irregular bone. Irregular bones includes variety of bones having irregular shape and size, and these bones won't fit in other categories. Example, vertebrae. Sesamoid bone. Sesamoid bones resembles the shape of sesame seeds. It develops in certain muscle tendons where they rub against convex bony surfaces during the movement of the joint. Example, pisiform, a carpal bone formed in the tendon of the flexocarpi ulnaris muscle. Functions of the sesamoid bone. It prevents muscles from excessive wear by minimizing the friction of tendon against the bone. It changes the angle of pull of the muscle. It acts as a pulley for muscle contraction. Classification of the bones, according to their structure. Most bones of the body have an outer layer of dense, smooth compact bone and an inner layer of spongy, porous cancellous bone. Compact bone. The texture of the compact bones is hard, densely fused with no visible spaces on naked eye examination. Compact bone is found especially in the shaft of long bones, and in the outer layers of short, flat and irregular bones. Cancellous bones. Cancellous bones are porous and spongy inside. Cancellous bone fills the central regions of the epiphysis of the long bone, and the inner portions of short, flat and irregular bones. Classification of bones according to their development. Membranous bones. It includes bones developed by membranous ossification, Cartilaginous bones. It includes bones developed by endochondral ossification. Membranocartilaginous bones. It includes bones developed by both membranous and endochondral ossification.